TikTok is under renewed scrutiny in the United States. The popular social media app is being sued by 14 states who claim it was designed to be addictive. And this week, we got our first look at video that shows TikTok employees discussing that same concern.
We obviously wanted people to spend as much time as possible on TikTok, which can be in contrast to what is best for your mental health.
I mean, the product in itself has baked into it compulsive use.
A compilation was shared with CBS News by the North Carolina Department of Justice. It is part of the evidence in a lawsuit filed against TikTok alleging the company misled the public about the safety of its platform. Joining us now is Laura Clary. She is an assistant research professor at the Johns Hopkins Bloomberg School of Public Health. Laura, thank you for joining us. As a parent of a child who loves TikTok, I am concerned about this, as well as many parents, I'm sure, across the country. But what are those potential mental health problems that can result from overuse of a platform like TikTok?
Yeah, a lot. And over the past 20 years, we've actually seen teen mental health problems gradually increasing. Things like depression, anxiety, body image issues, loneliness, and stress. And this is across the entire US. And this reached an all-time high during the pandemic. And since then, it has come down a little bit. But there are several factors that have contributed to this increase. And social media platforms are one contributing factor to that.
So one contributing factor, but why is it particularly dangerous when we think about these apps that are supposed to be fun and allow our kids to be connected? Why is it so dangerous for those younger users? And what are we to learn from it? Because I feel like a lot of us parents don't know how to put our phones down either.
Oh my gosh, that was exactly one of my points, but I can get to that in a second. First, adolescence is a very particular kind of developmental period. We call it a sensitive period. And that's because kids, particularly between the age of 10 and 16, their brain development, their physical development, their social development is really rapid at this point. So what that means is that they're sensitive to a lot of the stimuli and to new experiences. So what it does is for kids that age, it makes social media particularly addictive in a way that, sure, it is a little bit for us, for parents and adults, but it's particularly addictive for adolescents.
So are there signs that we should be looking out for that might indicate that a child has a problem, mental health problem that is linked to the app? Or how do you even make that distinction?
Yeah, I would just say that, if they're spending a lot of time, but also look at the content to make sure that they're not looking at content that is going to affect their mental health negatively.
All right. Laura
Yeah.
Clary, wish we had more time to talk, but thank you so much for your time.